This is Down2Talk, the HIV Awareness Edition.
Welcome back to the channel, everybody. My name is Tony.
I'm King K.
This is Down2Talk.
Yes, sir.
Thank y'all again so much for tuning in with us each and every week. If y'all haven't already, don't forget to like, comment, and subscribe to the channel. We got content just like this, dropping almost every single week, sometimes the next week. Here on this channel, Down2Talk, what we like to do is pretty much just get the conversation started. We've had an artist come on. We've had financial advisor come on and talk with us. We've even had a massage therapist come on. King K.
Big facts. And on this channel, we're all about changing the world one conversation at a time. If you have a business, come present it. If you're an artist, come perform. And if you have a testimony, please come share it. And today, we're going to be talking about health.
Yep. And we have a public health professional to come on and speak with us about this topic. Please help us welcome Shabaura Perryman.
How are you?
Nice to meet you.
Nice to meet you as well. Thank you for having me.
No problem, no problem. So tell us about yourself.
Well, my name is Shabaura Perryman, and I am, like you said, a public health professional. I specialize in education around HIV, and I work across the state of Texas, and I also am an advocate for people living with HIV.
Okay. So can you tell us the difference between HIV and AIDS?
Yeah, sure. That's a great question. So HIV, which stands for the human immunodeficiency virus, it is a virus that actually causes AIDS. So if left untreated, the virus can attach itself to your immune system, the cells in your immune system, and it can deplete your immune system. And once that happens, if your immune system is damaged by the virus, it leaves an opportunity for other infections to come into your body. And once that occurs, there is a diagnosis of AIDS. So AIDS is short for, and it stands for acquired immunodeficiency syndrome. And if left untreated, the person who is experiencing those different types of opportunistic infections, meaning, for example, pneumonia and some other bacterial infections, the person could succumb to the virus.
Right. Okay. Well, yeah, that sounds kind of in line with what I understood the dynamic between those two to be, because I know there's a lot of ambiguity between everybody whenever they hear either or the other, and it's confusing, I'm sure, to a lot of people, but thanks for clarifying that. And in terms of being detectable, can you explain to us what that means?
Undetectable?
Being undetectable?
Yeah, sure. So if a person is diagnosed with HIV, and they are starting medication, what the medication does, it helps to lessen the spread of the virus internally. Okay. And so what the virus is called a retrovirus. And a retrovirus, its own, not to be so scientific, but its only purpose is to make copies of itself. And so this virus that comes into your body, it makes copies of itself, but with the introduction of medication, it inhibits that process. So it kind of slows it down. And if a person is diagnosed, once they go to the doctor, they will see how much virus is in their bloodstream. And based on either the type of measurement that they use at the laboratories, it can tell how low the virus is. And so at that point, there is a marker maybe under a number of copies. Let's say, for example, under 200 copies, then that person is deemed undetectable. However, it does not mean that the person has been cured of the virus. It only means that it's based on the laboratory results that is so low in the bloodstream that it can't be detected. That's a great question. Thank you.
Right. So this virus is not like a common cold. You can't just, go get behind the counter treatments or anything like that. So how is the treatment for, HIV works?
Yeah, that is a great question. So pretty much the medication, what the medication does, it helps to slow down the process of replication. And what that means is that the virus, its sole purpose is to attach itself to our healthy white blood cells, and our white blood cells are like our soldiers in our immune system.
Right.
So if anything comes into our bodies, like if you have a cold that's foreign to our bodies, then our white blood cells, they start to activate. And so once they are activated, then they're like our soldiers in our body, so that it can diminish or deplete whatever is foreign into our bodies. However, when patients are taking treatment for HIV, it slows down that process of replication. And so medications are called inhibitors, and those inhibitors will attach itself to or block certain areas of the white blood cells that are being attached by the virus, and those cells are called CD4 cells. And not to be too scientific about it, but what it does is it slows down that process. And if you slow down the process, you're able to live healthier, you're able to live longer. And the good news, because we want to talk about the good news, is that a person living with HIV today has the same lifespan as a person who has not been diagnosed with HIV.
Okay.
So it's important to take your medication as prescribed. Oftentimes, doctors will tell patients to take their medication every day at the same time to keep the medication levels constant. So, medication has advanced. We've gone from multiple pills a day to down to one pill a day. And then there are some other new advancements on the horizon, such as injectables and things of that nature. So there's some great news that's coming, for the treatment of HIV.
Right. I'm sure. That's very important, like you said, because among the people that need that type of medication and that are actually seeking it, pretty sure a lot of people don't know that those type of medications and advancements are out there. So that's very key to the future.
Yeah. And in terms of access, so there's medication if you have insurance, if you don't have insurance. So there are federal funded programs where people can actually receive their medication from the state. So
Right.
There's the AIDS drug assistance program. Then there's other programs that can help people who don't have the money to pay for their medications.
Right.
Yeah.
And you had mentioned earlier about the treatments and living with HIV and it not necessarily being that different from when you're not diagnosed, and also having the same lifespan.
Yeah,
Now,
absolutely.
in terms of women, can women have babies living with HIV?
Oh, absolutely. So pretty much what they do is make sure that the mom is on their antiretroviral treatment, which HIV medications, and they also will have, once the baby is born, they will have the baby on medication as well. And so there's less than 1% of babies that have been born that what we call seroconvert to having HIV. So that's good news in and of itself, that the virus does not transfer over to the baby because of the advancement of medication.
Right. Okay.
So I want to talk about the community, especially the Black community. How has this virus affect us in the Black community, and how does it affect us moving forward? Like you said in the previous questions, that we have things coming and new vaccines and stuff on the way.
Well, not sure about vaccines that are that are on the way, but there are some that are in clinical trials. There are lots of clinical trials around vaccines. But in terms of the Black community, so HIV is no longer, well, really hasn't been what we would typically back in the 80s and 90s know about HIV as a white gay disease. It is disproportionately impacted people of color. So people who are African American specifically and Latino communities. So HIV is not something that is designated for any specific population, but in terms of the Black community, there has been, the majority of people who are living with HIV, out of 1.2 million people of color, specifically Black Americans, Black African Americans, make up about 44% of the people who are living with HIV in this country. And in terms of the South, since we are in Texas, in terms of the South, so the South makes up about the 13 states that make up the South have the largest population of people who are diagnosed with HIV. And out of that, about 58% are African American that are living with HIV. And when I say African American, I mean same gender loving men, Black women, Latino women, same gender loving Latino men. So transgender women make up all of those numbers in terms of the prevalence of people who are living with HIV in the South. Yeah. So, but in terms of medication, education, so we talk about social determinants and things of that nature that impact a person's ability to get into care. So in terms of social structure and social injustices, education, things that are in your community that make you whole, those things we have to focus on. And because we have tools in our toolbox to help people who are living with HIV to live healthier and longer lives, but we need more resources in terms of making that person's life better. So, but for the majority of people who are living with HIV in the Black community, stigma is still on the rise. Hopefully, with more education about HIV and how people can actually live longer lives with HIV, then hopefully that'll change the narrative.
Okay. That's interesting, and you had mentioned stigma in the last part of that answer. I kind of want to touch on that a little bit and want to ask you, how does stigma play a role in how people view HIV? Yeah, so of course, since the early days of HIV, since stigma has always played a part, and those stigmas from families not wanting to be involved in a person's life, to deeming women as promiscuous, or even men in their sexual behaviors. Stigma has always been a part, and with stigma brings on more people being diagnosed because of fear, but people are living longer. People are living, this is a chronic illness, it's not terminal, it's not a death sentence anymore. You cannot contract the virus from eating, from touching a table or hugging someone or kissing someone casually. And stigma is something that needs to go away, because with stigma, it brings on more health problems in terms of mental health issues and people not wanting to be involved with people living with HIV, and it needs to stop. Right.
Yeah.
Okay. Well, that pretty much wraps up the interview portion. We want to thank you again for coming on and helping us just talk about something so serious. But did you have any words of inspiration or of knowledge that you wanted to share?
Yeah, I do. I do want to just say that if you know someone who could possibly be diagnosed with HIV, you want to be caring and open and talking to them.
Right.
People are people. You know, we want to be involved. We want to be heard. We want to be embraced. And just because a person has been diagnosed with this virus doesn't mean that that person needs to be outcast. That person needs to be loved and understood. And in terms of resources, if you are diagnosed and you're looking for resources, or if you know a family or a friend that has been diagnosed and you want some more resources, you can go to HIV.gov, has lots of resources in terms of locating a physician, learning more information about the virus, and it's a wonderful tool to be able to get more education about.
Okay. Mm-hmm. All right. And then King K, did you have any last words?
Like she said, the virus is not a death sentence anymore. So, you know, get out there, live your life, and keep God with you.
Right. All right. Well, again, thank you again so much for coming on. That pretty much wraps up everything. And to our viewers, thank y'all again so much for tuning in. Again, if y'all haven't already, don't forget to like, comment, and subscribe to the channel. We have content just like this and knowledge just like this that we want to pass on almost every single week. Thanks again for tuning in. Catch us next week or the week after. This is
Down to Talk.